So some of for those who just joined us, I've just set the recording. I forgot to record it for the ones who are not going to be able to join us, so they can send you the video. Anyway, so like I was saying, thank you so much for joining me, Dr. Nilima. So like I said, the last time we had a chat, we were talking about the polycystic ovarian syndrome, which until that time I didn't understand the importance of the problems that a lot of women are actually experiencing. But the issue that I find is that a lot of women don't really discuss these symptoms or issues that they deal with, because one, they think it's normal. Two, they feel like they've tried everything they can. They have, I guess, they have no answers. Or four, they're just suffering in silence because of some of the symptoms that they have, which is, I guess, according to them, very embarrassing. Now, as a health coach, with I guess the journey that I've been through the last few years, a lot of women have obviously been through my program, and a lot of them have obviously experienced some of the issues that we have. So today we're obviously talking about menopause and the role of nutrition and functional fitness to help mitigate symptoms and risks. Now, you're very well versed in this topic. I mean, you are an expert in women's health. And I am very obviously grateful for you to join us today because of all the knowledge that I know you will be able to impart to the people who are watching, the people who are going to watch the recording. So I guess I'll just go straight in and say, what is menopause, and, why is it a problem now? How would you go about answering that?
Thank you so much, Diane. Thanks for inviting me again, and for all the people who are watching us. This is definitely a topic that's right up my street. I've been helping women with menopause and hormone problems for over 30 years now. And even though the term menopause hasn't changed and the symptoms that women suffer with haven't changed, a lot has changed in 30 years. When I was in medical school, we defined menopause. So menopause is the last period a woman has. So it kind of marks a watershed between being able to reproduce and then not being able to reproduce. So being able to have kids and not being able to have kids. Technically, that's what happens to your body. It stops, or it runs out of eggs in the ovary, and that's what causes you to have your last period. Now, by definition, you're menopausal when you haven't had a period for 12 consecutive months. Now, simply from the definition, you understand that it's a retrospective diagnosis. So you don't know that you're menopausal until you've gone a year without periods. Mm-hmm. Now, the difficulty comes where, just like 30 years ago, women had complaints about, oh, I've got hot flushes, oh, I've got this problem, oh, I don't feel like having sex, everything about my husband irritates me, I'm crying all the time, my body hurts. So those symptoms haven't changed, but the sheer number of women going through menopause has increased a lot. And that has got to do mostly with increasing life expectancy. So in the last 50 years, there are more women who are actually living beyond 50, and the increase in population. So proportionately, as the population of the globe has increased, so has the number of women going through menopause. I'm just going to wait for Dee to come back. I think she is probably logged off because of internet issues. Hey, she's back.
I'm so sorry.
What happened?
The screen just went dead. I don't know if it's the power. I'm really sorry about that. Did I disappear?
Yes, you disappeared.
I am so sorry about that. I'm not sure what happened. I think there's been some issues with Zoom, so I really apologize for those who are watching. It looks like the streaming is still going on. So
yes.
Sorry about that. Where were we?
So I was talking about menopause and how in the last 50 years, more women are going through menopause. Simply because the population size has increased, and secondly, because more women are living beyond 50. So the average age for menopause globally is between 51 and 52 years. In some populations, in especially Southeast Asia or India, menopause happens a little bit earlier. So it happens between the ages of 48 and 49 years. So by definition, women who go through menopause before the age of 45 are said to have an early menopause. Women who go through menopause before the age of 40 are said to have had a premature menopause.
Okay. So you said that the age is from 51 to 61, did you say?
50 to 52. That's the global average age of menopause globally.
Okay. Now, would you say that menopause is inevitable? Like it's something that we definitely have to go through? Or are you saying that there's some people who, is it always at 50 to 52, or that can it delay?
Well, look at it this way. When you were in your mother's womb, you had a certain cohort of eggs in your ovaries. By the time you were born, that number halved. By the time you went into puberty, again, that number halved. So by the time you started menstruating, you have about 50,000, 60,000 eggs left in both your ovaries. Now, a woman doesn't have 50 or 60,000 cycles in her lifetime. She has far fewer. But what happens with every cycle is that your body recruits maybe 7 to 12 eggs, and of them, one egg becomes a follicle and is released. Now, if that egg gets fertilized, it forms a baby. And you and I know that women don't have 50,000 babies. Most women will have one or two kids. Maybe, if you come from your grandmother's generation, you would have had 5 or 6. But not every egg turns into a pregnancy, which means there's a lot of wastage. And human reproduction is very wasteful. Consider that, you've got 50,000 eggs, of which only 1 or 2 or 3 become babies, and men produce millions of sperms, of which you only need 1 to fertilize the egg. Yeah. Now, as you go through your reproductive life, as you go beyond the ages of 30, 35, most of the eggs that are left behind in the ovary are the ones that didn't respond very well to the hormones that were coming from your pituitary to try and produce the eggs. So you've got remaining in your ovaries a lot of eggs that need more stimulation to be released. Okay. And then as you go into your 40s, you'll find that every cycle that you have, you may or may not release an egg, and there's fewer and fewer and fewer eggs being released. So for example, if menopause doesn't happen suddenly, neither does premenopause or perimenopause. So a woman has, say, 12 cycles a year, 12 or 13 cycles a year. Not every cycle has an egg to be fertilized. Even in the most fertile years of your life, you may release, 8 or 9 or 10 eggs a year, not 13. So as you go into your late 30s and 40s, and as you go into your late 40s, fewer and fewer cycles will have an egg released. And as the eggs run out from the ovaries, eventually you'll have your last period. Your period is nothing but the lining of the womb that's being shed. The lining was being prepared for a pregnancy, and the pregnancy didn't happen, and that's why it shed. That's a period. That's what a period is. So when you have no more periods, it means your body is not releasing any more eggs. So you'll release fewer and fewer eggs, and eventually there won't be any eggs to release, and then you don't have a period. And when 12 months go by and you don't have a period, you're said to have had your menopause. The symptoms of menopause will happen a lot earlier. Now, does menopause happen to everybody? Technically, yes. You don't have unlimited eggs. Now, the only reason we have more and more women experiencing menopause is because more and more women are living beyond the age of 50. If you consider a country like India, a developing country like India, around the time when we became independent, 1947 or so, the average life expectancy of a woman in India was only 37.
Oh, okay. Wow.
Okay. So now, today, life expectancy for women in India is 78 years. Wow. So there's a huge number of women who's going to experience menopause simply because they're living beyond the age of 50. And I suspect a lot of that is also something that happens globally. 1 billion women are going to experience menopause globally in the coming 5 years. In a country like India, where the population is huge, country like India, China, Southeast Asia, we'll see between 150 to 200 million women in each of these countries experiencing menopause. Wow. So the burden of problems that these women face, and we'll talk a little bit more about the health issues associated with menopause, is huge. And none of these countries are actually prepared. The world is not prepared to handle the health crisis that menopause is going to bring, which is why we are having this conversation, because I'm really passionate about this topic and about the way we need to help women to take charge of their own health, because there are not enough specialists to take care of menopausal women, the sheer number of women going through menopause globally. And
Wow.
even though we know that menopause will happen to every single woman, that is not something you can prevent. There's no such thing as preventing menopause. But the health challenges that a menopausal woman faces is something you can prevent. Because even though we know about 60 to 70% of women will experience some sort of symptoms relating to menopause, they all don't suffer the same problems in the same way. And only about 15% of women will suffer severe symptoms, symptoms that incapacitate them or debilitate them or affect their quality of life in such a way that they find dealing with life really, really difficult, which means that, over 50% of women actually do quite well. So it's nothing to be afraid of. It's not something that should strike terror into somebody's heart. It's definitely something that can be managed and lived with. And you can certainly live a very productive and happy and healthy life beyond the age of 50.
Okay.
And probably this is why, 50 is considered like a watershed. For menopause, what got you to 50, all the different strategies that women use for their fitness, for their health, for their well-being, and we'll talk more as we go along, until the age of 50, that doesn't usually work after the age of 50.
Oh, wow.
You need to learn new strategies. You need to learn a lot about menopause and how your health is. And considering that menopause is actually quite a new specialty, if you consider that in the last 50 years, is very recent that so many women are going through menopause. So all of the medical research we have around menopause and the management of menopause and the treatment of menopause is also very recent.
Wow. Okay. So obviously, because women are living longer, a lot more women will experience obviously menopause. So I guess just around that topic, what would you say are some of the major problems that women actually face as they age that needs actually action before menopause? So as they're aging, because they're obviously getting to, after 50 years old, a lot more people are going to be able to start experiencing menopause. But I guess before we go, deeper into menopause, because right now, I'm sure there's some people who don't necessarily have experienced menopause, but there are some symptoms that they're going to experience before they get to menopause. So what would you say are some of the symptoms that they would get?
So there's two questions there. One is about the symptoms leading up to menopause, and the second is about the health challenges that women face that they need to be dealing with much before menopause sets in. So let me address the second question first. So the health challenges that we face as we get older are mostly related to heart disease, to high blood pressure, all of the metabolic syndrome, diabetes, obesity, problems relating to sleep apnea and sleep disorders, problems relating to mental health, so psychological problems, depression, anxiety. Alzheimer's disease is a big one coming up, and women are 4 times as more likely to be affected by Alzheimer's than men are. And osteoporosis. Osteoporosis is the silent epidemic that we're facing as the years come on. Now, as we come to the symptoms, the important thing to understand is that the symptoms of menopause that women talk about, and they often go along searching on the internet, or they go look asking their friends, they're trying to borrow their friends' remedies, or they're searching on YouTube desperately for some natural method or the other. Can I do this, or can I light some incense? Can I go and meet somebody? Can I do some meditation to solve these problems? Those are all bothersome symptoms of menopause. The most bothersome symptoms of menopause, the most common one is hot flushes. So many women can start experiencing hot flushes as early as their mid to early 40s. So as they enter into their 40s, they can start experiencing hot flushes. And this is a dysregulation of the temperature regulating mechanism inside our bodies that is governed by estrogen in our bodies. And as estrogen levels drop, and remember, there are no hormones, just plummets like this. So there's at the age of 40, you'll have a little dip, and it'll go up again, and it'll dip. And as it goes down, it will go in a decreasing trend until you have your last period, and then gradually it flattens out. So there's no more swings. And the hot flushes are reflections of these swings that happen in our body. And at the level of the hypothalamus, which is a gland that's situated inside your head, and the temperature regulation that happens, the various blood vessels in the upper part of the body, they suddenly dilate. And you find this creeping heat coming up your face, chest, and there's a sudden sweat that breaks out. You start to feel hot, you might feel a bit weak, you might feel like sitting down suddenly, feel a bit wobbly. And then you wait for a bit and suddenly a chill sets in. So as the sweat starts to evaporate, you become chilly. When you experience in the daytime, they're called hot flushes. When you experience them at night, they're called night sweats, because you can end up waking up in a pool of sweat.
Yeah.
Now, we know with more recent research that hot flushes are also correlated with the heart disease risk of a woman. So the more severe and longer lasting hot flushes are, the higher her risk of developing a cardiac event, heart-related event. The second bothersome symptom is of vaginal dryness. Now, vaginal dryness, even though we know hot flushes eventually do peter down, they become less and less frequent. Once you go through menopause, they become less and less frequent, less and less intense, and gradually, a very small percent of women will still be having hot flushes in their 60s. Yeah. Vaginal dryness is the one that hits women the most because it's the most embarrassing one to talk about. They don't like speaking about it.
Yeah.
So there is a progressive dryness that happens at the level of the vagina. Now, considering that there is dryness happening everywhere because of estrogen, you have your hair follicles changing, your eyes become drier, there's more wax in your ears, your mouth feels drier, there's burning in the mouth. So the same change of dropping estrogen levels is reflected in the vagina. It manifests as vaginal dryness, difficulty with getting aroused, pain with intercourse, wanting to go to the bathroom, to pass urine more often, getting burning when you're passing urine. Yeah. And initially what happens is when they first start experiencing these symptoms, women feel that they've got an infection, a urinary infection that doesn't seem to go away. And for most women, they just end up going to their GP and getting antibiotics for an infection, which is one of the mistakes that I keep talking about that we shouldn't do, because the symptoms of burning and dryness overlap with a urine infection. So unless the woman's actually had been checked out for a urine infection, she shouldn't take antibiotics. What she might need is some vaginal estrogen.
Wow. Okay.
So the vaginal dryness is progressive. So it doesn't settle down unless you get treated for it. So this is something that women don't talk about and they don't get help for because they're too embarrassed. And they feel, oh, well, it'll get better after some time. Yeah. It'll just get better. And the problem with vaginal dryness is it never gets better. And as you leave it, if you don't treat somebody at all as they go through menopause, the longer they live, the vagina shrinks. So it becomes less rugose. So the vagina normally has lots of little folds in it that allows it to expand. So in a woman who's of reproductive age, the vagina has lots of little rugae, and they exist that when the baby comes through the passage, the vagina can expand, longitudinally, horizontally, allow the baby to come through. Yeah. As you go through menopause, the vagina becomes flatter, so it loses that flexibility. It kind of becomes narrower. It also becomes shorter, especially in women who are not sexually active. So if you don't remain sexually active as well, the vagina starts to shrink and become narrower and narrower and narrower. Yeah. And this is progressive. So it's very important to remain sexually active and get treated for vaginal dryness because it tends to get worse over time. Okay. These two most bothersome symptoms. Other symptoms that tend to affect women can be irritability, mood swings. They get snappy and they get really intolerant. My dad used to say, you don't like stupid people. Yeah. But that's not people being stupid. It's just your tolerance level goes down. For little irritations, you start to get more irritable. You tend to snap back, or you tend to lose your temper a lot more easily. You also become more moody and depression. This is relating to decreasing estrogen levels. And we'll also talk about nutrition. I know we're talking about nutrition later on, but nutrition also plays a huge role. As you go through menopause, one important thing that happens to our system is the dryness, the decreasing. As the eggs finish, so does the estrogen level. That is what we're talking about. As long as there's eggs in the ovary, you're releasing estrogen and progesterone with each cycle. As the eggs decrease, your estrogen and progesterone both start to go down. Progesterone goes down faster than estrogen does because the eggs are not being released. Yeah. But as your estrogen goes down, there's a dryness that happens throughout your body. You'll notice it on your skin. You'll also notice it in your mouth, less saliva, and that affects your teeth and gums. But that dryness is also experienced throughout your gut.
Oh, okay.
Through the entire intestinal system. So remember that in your intestines, you've got bacteria, you've got all kinds of systems, you've got enzymes, you've got secretions, you've got mucus, you've got lining, you've got folds of the intestine. So all of these things in a woman's body are also responding to estrogen. And as you go through menopause, there's a progressive flattening out of these systems. So that affects your ability to absorb nutrients.
Oh, wow. Okay.
It also affects the kind of bacteria that are residing in your gut. So as you start to go through menopause, many women find that it doesn't matter how well they eat, they just don't feel the same as they used to before because of this dryness. They also don't absorb nutrients the way they used to before. Particularly, this is important for fat-soluble vitamins. And you and I both know how important fat is for mental health.
Yes.
Your brain is made mostly of fat and cholesterol. If you don't eat healthy fats, you don't eat healthy fatty acids, you suffer the consequences. Now, many women are familiar with body pain. They're familiar with joint pain, they're familiar with neck pain, backache, they're familiar with swelling ankles, swelling feet, fingers, inflammation. And my question to you is, if your body tells you it's in pain with these symptoms, how does your brain tell you it's in pain?
I guess the headaches and the mood swings and,
So the headaches are more related to the muscles, but it's the mood swings, it's the depression, it's the negative loops of thinking, it's the thoughts that don't go away, it's the fixation that you get on something, you can't let go of it.
Yeah.
This is how women experience their brains as they go through menopause. You find one negative thought and you just can't let go of it. Your boss says something to you and you can't let go of it. You have this, knee-jerk reactions which you wouldn't have had, 5 years before. You're just not able to do the, count to 10 before you have an outburst, and you've had your outburst before you can count one.
Yeah. Wow. Okay, but I don't think most women
the
know
level of the brain. This is happening. And yet, those who meditate, those who learn to observe how their symptoms are coming up, how their body sensations are evolving, do get better. But I have experienced is that until these swings of estrogen and progesterone gradually start to settle down, your brain fog and this reactivity of your brain takes effort to control.
Okay. You mentioned something initially, with regards to the vaginal dryness, and it's caused by the reduction of the estrogen. Now, is there a way to slow down the reduction of estrogen, or maybe keep it intact? I'm assuming because it's a natural way of aging, that is not something that women can actually reverse or stop or delay. It's all just,
So one of the reasons a whole lot of modalities, and one of the reasons the pharmaceutical industry is focused on supplying estrogen is because the sheer number of women who are wanting to continue with their lifestyle exactly the way it is without compromising, but they just want to fix. They want the hormone fix, and that's perfectly okay. There is a group of women who never need estrogen replacement because they adapt very well to the decreasing estrogen levels, and estrogen levels never become zero in anybody who's still got their ovaries.
Okay.
Because even in women who have their ovaries removed, a small amount of estrogen is still produced from another gland, which is called the adrenal gland.
Yeah.
Now, there's a very fine balance of how estrogen, progesterone, androgens, cholesterol, adrenaline, noradrenaline, epinephrine work in your body. We know from the cascade, cholesterol is your root molecule in the body. Cholesterol is a very important molecule. Cholesterol in your liver is then converted into a number of these hormones through different cascades. There are different cascades that happen both in men and women. In men, predominantly the cascade is towards testosterone, and in women, the cascade goes down to estrogen, progesterone.
Yeah.
On top of this, also there is another cascade that comes from your brain, which is oxytocin. Oxytocin is a hormone that's released from your pituitary gland, and most women know of this hormone as the hormone that helps them to go into labor.
Yeah.
Okay. It's also called the bonding hormone. So oxytocin is also the hormone that allows you to have a milk ejection reflex when your baby starts to suckle.
Yeah.
It's also the hormone that allows you to bond with your baby. Oxytocin is also a love hormone. So it's also the hormone that's released when couples have sex.
Yeah.
But the most important role as we go through menopause is to understand your oxytocin and your cortisol levels also balanced. So if your cortisol levels are very high, which means your stress levels are very high, a lot of the cholesterol gets diverted into manufacturing cortisol. Your oxytocin goes by the by, and your estrogen and progesterone go by the by.
Okay.
So that's how stress impacts your ability to handle estrogen and progesterone below this level.
Yeah.
Now, if you have lots of oxytocin, good feeling hormones, relaxation, deep meditation, deep connection, spiritual connection, walk a lot in nature, you have adequate exposure to sunlight, then your stress levels are lower. When your stress levels are lower, most of your cholesterol gets diverted to manufacturing estrogen and progesterone, even though it's declining. And you do not suffer the drops in estrogen and progesterone as much.
Okay. I
Now,
wanted to ask you.
cortisol levels, your stress levels can be aggravated by your lifestyle, by the different kinds of things that stress you out. And the diet is a big thing that stresses the body out. Common P's, I call them the 5 P's: pesticides, pollutants, petrochemicals, personal care products, all of these things, plastics, they cause a lot of stress in the body. They cause a lot of toxicity, and your body has to deal with that.
A topic in its own. I mean, when you talk about the
So all of these things make your cortisol levels go up. And when your cortisol levels go up, there's less available to make estrogen and progesterone.
Yeah.
Now, how do women manage, or how should you top up your estrogen levels? You don't want to top up your estrogen levels just for the sake of topping them up. That is why we want to deal with the symptoms, because the symptoms affect quality of life. So how do symptoms affect quality of life? They affect quality of life by, hampering your ability to, say, get through your day. You find the brain fog is that you can't focus, you can't concentrate. I know, for years we've been trying to help women get into corporate positions. A lot of women who are in the top positions today, as a businesswoman, you understand this. When you're at the top of your game, you're more likely to be in the age group of 40 to 60.
Yeah.
Less than 30% of companies worldwide have a woman at the helm. And 80% of these women are between the ages of 40 and 60.
Yeah.
Now, if you consider that this woman needs to be in charge of how she comes across, more than likely she's got a board full of men who are high performers, who are looking at her and waiting for her to trip up or make a mistake. Unless she's an all-woman company. But the last thing you want is to stand up to do a really important meeting and then break out in a sweat, or have to sit down because you're going dizzy.
Wow. Okay.
Yeah. Or be seen as, if you consider even mothers, women are having children later and later. Many women who have children late 30s, early 40s, they're exhausted. They have a 6 or a 7-year-old and who needs ferrying, go to tennis classes, go to swimming classes, go to this class, that class. And the woman, she sits in the car and she says, oh, I forgot my car keys, or I forgot my wallet. I need to go and get it. And then the kids are like, Mom, what's wrong with you? Blah, blah, blah. And she's irritable.
Yeah.
So this affects quality of life. Or she's so exhausted by the evening, her husband comes up to her and says, can we have some action tonight? And she says, no, I'm exhausted. Or she snaps. Or it's so painful that she doesn't want to engage.
And maybe she hasn't even mentioned it.
Or another problem that women have as they enter their 40s is heavy periods. I know you talked about things like fibroids. Now, fibroids are estrogen dependent, so they don't go away until menopause goes away. Fibroids will shrink after menopause. But if this woman has severe symptoms, she has very heavy periods, she's going to be exhausted. One of the commonest problems of women in their 40s is anemia, because they lose so much blood during periods. If they're anemic, they're going to be exhausted all the time, they're going to be moody, they're going to have so many other problems, not being able to sleep properly, poor work efficiency, not being able to concentrate, brain fog. All of this stuff happens because of anemia. And these symptoms are very difficult to differentiate from another problem, which is thyroid issues. Hypothyroidism is much commoner in women as they go through their 40s and 50s. So they're all kind of connected to each other. Menopause symptoms, symptoms of anemia, symptoms of thyroid disorders, they all overlap. Now, in women, we have something called a menopause rating scale. So it gives you a score for physical symptoms, psychological symptoms, and genital symptoms. And depending on which symptom is predominant, then your medical practitioner can evaluate on based on your score what kind of treatment, what kind of hormone therapy or supplementation or management would be most effective for you. Like suppose somebody has more genital symptoms, their vaginal dryness, bladder irritability, not being able to control their bladder, leaking, stress incontinence, overactive bladder. These problems are going to get worse if you don't treat them. So these women need vaginal estrogen.
Yeah.
They cannot be managed with herbs.
Yeah.
So the doctor who sees these women has to first make sure there's no contraindications. So make sure that they've not had breast cancer, they don't have some sort of severe liver disorder, something that contraindicates being given even vaginal estrogen, for which there are very few contraindications.
Yeah.
Vaginal estrogen should be used for a lot more women than is currently being used.
Okay.
So vaginal estrogen will help with those vaginal symptoms. It will stop the vagina going dry. It'll help with getting aroused. It'll help with lubrication. It'll help to, keep the bladder more stable. It'll reduce the burning and stinging with passing urine. It helps managing overactive bladder and leaking urine a lot more easy.
So let me ask you a quick question, because I know maybe it's just a very important question to ask, because there's some women who they sort of suffer with these symptoms because either they're too embarrassed to obviously ask about it, or they don't know what the symptoms are. If you don't mind, maybe just listing it without going into detail on it. Apart from, the vaginal dryness, what are some of the most embarrassing symptoms for menopause? At least so that anyone watching this, either recorded or live, they would at least have an idea. Okay, you know what? I had that. I didn't associate, that symptom with this. If you just to list a few, what would you say are the most common, especially embarrassing ones that women don't actually mention? Because you mentioned the vaginal dryness.
Ones, the genital ones tend to be the most embarrassing ones for which women don't get help. And we know that women with incontinence will leave it for 5 or 6 or 7 years before they actually ask anybody for help. And by that time, as we talked about, vaginal symptoms tend to get worse. They never get better. They will continue to get worse. Now, if you look at physical symptoms, amongst the physical symptoms is hot flushes. Yeah. Again, women keep looking for natural ways to relieve hot flushes. But what happens is, because the range of time over which these symptoms last, almost 15 years, if they're really bad and they don't get investigated, especially like for heart problems, then they're missing out on good quality care.
Yeah.
Some of the symptoms can be managed with what we're going to talk about later. But the hot flushes, the headaches, body pain, palpitations, getting, feeling your heart race, feeling as if like, stuff is coming up your throat.
Yeah.
That actually, your joints swelling up, your feet swelling up.
Okay.
These are the physical symptoms.
Yeah.
Then you have symptoms of, memory loss, not being able to sleep properly.
Yeah.
You might get things like breast tenderness, swelling, lumps in the breast. You might get, with your psychological depression. We know that almost 30% of women experience depression for the first time in menopause. Now, if you're somebody like me who's experienced depression in the young adulthood or whatever, then it's not such a big deal because you know how to manage it.
Yeah.
You know what the symptoms are, you've dealt with it, you've got some coping strategies, you've got some. But imagine that 30% of women who experience depression for the first time in menopause. There's this one amazing, bubbly, positive person, and it hits them like a ton of bricks, and suddenly they don't know why they're in a funk, why they feel like crying all the time. They can't seem to get out of it. So depression today, depression is one of the main reasons of suicide in the early 50s for women.
Oh, wow.
So it's preventable. So it's a big reason for why we lose a lot of women. So psychological symptoms, depression, anxiety, anger, mood swings, loss of concentration, memory lapses. A lot of women think that, these memory lapses that I'm experiencing in menopause, it means I'm going to get Alzheimer's. But actually, it's not. It's just an overload of information that you've not been able to manage because of the brain fog, because you're not sleeping well at night, because you're overwhelmed with emotions and the inability to deal with the stress in your life. And the more stressed you get, we know the more your cortisol goes up, the worse your menopause symptoms are.
Yeah.
So the available estrogen you have, it doesn't just not there.
Okay. Well, you pretty much answered, I think, the question I was going to ask next.
Lots of desire, lots of libido is something that women don't talk about.
Yeah.
for husbands. Now, if you think that a couple comes, if the woman is going through menopause, it's very likely that the man is also going through his own share of problems. At that age group, men are also having trouble with erectile dysfunction. They may be having trouble with metabolic disease. They may have their share of heart disease, or fatty liver, all of these difficulties coming. So they have loss of desire as well. And the women also have loss of desire. That's their main thing. Loss of desire, vaginal dryness, pain with intercourse.
Okay. So, to be honest, my next question was going to be, I guess, the importance of women educating themselves about these symptoms. I think you pretty much touched on most of them, because if women are educated about what it is that they should experience or some of the symptoms that they should expect, I guess, before they get to menopause, one, it sort of like helps to know how to, I guess, mitigate some of the symptoms, or at least know how to deal with them, or at least anticipate them, so that when it does happen, I'm assuming they'll be more, I guess, aware, so that they're not thinking that something's going wrong, especially, with the depression. So you'd say that the most important thing really in terms of educating themselves is so that they can actually have a good quality of life really as they age, and not feel like something's actually broken, right?
Actually, I would go a step further and say you need to educate yourself as well as your daughters, your friends. If you've got a mother-in-law, educate her. If you've got a daughter-in-law, educate her. Because heart disease doesn't just happen because you entered your 40s. The foundation for heart disease is beginning in your 20s and 30s. The foundation for high blood pressure and diabetes is being laid 20 or 30 years before. Your foundation for Alzheimer's disease, which sets in your 60s and 70s, is being laid 30 years before. The foundation for osteoporosis is being laid in your teenage years.
Yeah.
Your bone mass at age 25 determines your bone mass that you're going to go through at the time of menopause. So if you're a woman going through, and typically what happens, women going through menopause have teenagers. So the mood swings of the teenager and the mood swings of the menopausal woman are happening at the same time. So it's a very critical time for relationships, boundaries, communication, education. That sometimes the education needs to come from outside, because neither of these two individuals are in a mood to listen to each other.
Yeah, true. I mean, look, as a wildfit coach, look, I'm obviously not an expert in menopause, but the only reason why I decided to do this, I guess, discussion is because I have women, most of the women who I guess are attracted to my coaching is, the women who are over 40 years old. And I'm sure there's some who are sort of like experiencing some of this. And I know some of them would probably mention some symptoms. I'm thinking, maybe that's part of menopause, but I can't obviously come out and say it unless they actually decide to speak to me and let me know what's going on. So I guess for me, being able to discuss this and being able to maybe give it to my clients or anyone really who's interested in their health sort of helps open that door, so that when I am doing my coaching, they're able to sort of like be like, oh, you know what, by the way, this and this, I'm experiencing this and this, and then I can also obviously help guide them better. So that actually pretty much gives me to my next, I guess, question. Now, you're an expert in women's health, okay? You did make a decision to obviously become a wildfit coach. Would you be able to maybe just briefly give me the reasons why? Why? I mean, you're already well educated, like I said, an expert in women's health, but you chose to become a wildfit coach. Why would you do that?
Well, I, more like most women, my most desperate need was to lose weight. I've been on a diet since I was 12.
Wow.
Since I first started studying food and nutrition, I put myself on one or the other diet, experimenting with my body. And I didn't have a significant weight problem, because I could always exercise it off until I underwent spinal surgery. And then it really hit me that nothing I knew about nutrition or food was particularly helping me. I could follow n number of diets, lose 2 or 3 kilograms, and put it all back on again. And my difficulty was sustaining all of those different diets. And you name a diet and I've tried it. Pretty much all the years. So I did WildFit out of desperation, because by the time I did WildFit, I was very sick. I was suffering with severe back pain. The consequences of that were fibromyalgia. I was depressed. I was suicidal. I had swelling in my hands and feet. My face was always puffy. I felt like I was wearing a helmet all the time.
Wow.
I was really irritable and angry. And you know that, when your body is not nourished properly, the first thing that happens is you get angry.
Yes. I was a very angry person for
Yeah.
a very long time.
One of the biggest problems, the reason we have with crime across the world is mostly because people are desperately hungry. Their brains are hungry for nutrition. When you're hungry for nutrition, you become less compassionate, less kind, less able to share. And that's exactly what I was experiencing. I was in a very bad state. So when I did YFIT, and before I did YFIT, I was put on some supplements by someone, and that improved me by 40-50%. Things improved a lot. The pain decreased. But I wasn't better and I wasn't losing the weight. When I did YFIT, I think week 4 or 5, all my pain disappeared completely.
Wow.
And then the fat just melted away. It was the easiest thing I've ever done in my life, even as a vegetarian.
Wow.
Even as a vegetarian, you know how difficult it is to be.
Yes. Yes.
Even as a vegetarian, it was the easiest thing I've ever done. I never felt deprived. And my mental health improved incredibly. My mood was so much more balanced.
Yeah.
It was the first time in 20 or 30 years I wasn't suicidal and I wasn't crying every night to sleep. And the brain fog lifted. And that particular year, the next year, I didn't become a YFIT coach the same year. My mom was so skeptical of me because I've been on so many diets. She says, well, let's see if you can maintain it. Don't bother, altering your clothes or doing new ones. Make sure you don't buy anything new because you're just going to be back at the same thing. I know you. So I didn't, I gave myself another year and then I got stuck in the UK in lockdown. And as I was in lockdown, I started to see more and more of my friends suffering the same problems I was. And it was then that it hit me that my problems were overlapping with menopause symptoms. Even as a gynecologist who's been treating menopausal women, I wasn't, that self-reflection, it didn't tweak in my head. Oh my God. I just started blaming my nutrition. I blamed, it's my back pain, it's my fibromyalgia. I never connected the fact that this menopause stuff was overlapping with it. And then I discovered, when I created my course on menopause, and I had a whole ton of menopause women come, a whole lot of doctors attended. I thought, I'm not going to get anywhere until they understand how to do YFIT. Until they fix their nutrition, there's no point. I can't get them to do anything else unless they fix their nutrition. I can give them all of the advice. I can tell them about heart disease, diabetes. But unless they do YFIT, they don't experience what I'm experiencing, this freedom in this body to, to flourish and to think so sharply, to go from not being able to read a page and turn it over 10 times to being able to again, speak like this without pausing. It was like it's amazing, it comes out like this. I say, you can have this too, but you've got to understand how. And that's when Rakhi, Rakhi is my dearest friend.
The first coach.
You've got to do this. So she forced me into doing this. That's how I ended up becoming a YFIT coach.
Wow, that's amazing story, because obviously you have all this information, being a doctor and everything, and also as you were going through the experience, being a doctor, you still were not able to pinpoint the fact that, oh, I'm actually going through menopause. But I guess the most important thing you've said there right now is that you could hold these seminars or group discussions about how to to deal with the symptoms, but you, after having gone through the program, you're like, I can tell them all this stuff, but unless they know how to deal with the nutrition, which I guess what has helped you out with, it's not going to work out. That's really, really amazing. What would you say is how did WorldFit sort of like help your clients? How have you been able to help your clients with
See, one of the biggest things, women are looking for natural ways to deal with their menopause. Nobody, like, there will be a small group of women who need the treatment. They need hormone therapy to manage, and those are the women who should never be denied that treatment, because it can make the difference between living and dying. So those women, but the problem is they never get to a doctor because they're so hung up on, oh, I don't want treatment. So when see, any kind of treatment is going to work better if you're properly nourished. Any kind of treatment. And I think the biggest thing I tell women is, it doesn't matter what medication you're, whether it's for thyroid disease, anxiety, depression, whatever medicine you're on, it's a crutch. It's only giving you enough time so that you can go back and fix the root cause of it. The root cause of it is your body is not nourished.
Mm, mm.
And if your body is well nourished, it will take you even through menopause without really suffering much. It's just a transition. It's not a death sentence.
Yeah, yeah, yeah. So you're
It's a
saying that.
normal, it's a normal physiological part of life.
Mm, mm.
And you get to celebrate. I mean, I know loads of menopausal women who are absolutely thrilled with the fact that they never have to worry about carrying pads
I know.
everywhere, bothered, and their fibroids are shrinking, their moods are even, they don't have that up and down that comes with every period.
Mm.
They're not kind of snapping at their husbands and kids just because, oh, I'm going to be on my period. No
Yeah,
such
yeah,
thing. Like the even mood, the clarity of thought. Women love being in menopause. The freedom you have, like you just don't tolerate bullshit anymore. You
yeah,
suddenly have this clarity where you're not clouded by, oh, I've fallen in love with somebody. Shouldn't have sex with him. No, you menopause. This guy's taking advantage of me. I'm not having any of it.
yeah, yeah, yeah,
And that power that comes
yeah.
with that even hormone levels is what you want to get to. Now,
I,
how do you help a woman get there in the
mm,
smoothest possible way? That's all the management is about. It isn't about postponing menopause. It
mm,
isn't about topping up your estrogen levels. No,
mm.
you need just enough estrogen so you don't suffer the damage to your quality of life. You maintain your quality of life
Yeah.
as you reach the stage where everything evens out. That's what you need the help with.
Yeah. So you're saying, because like I said, a lot of women have this dread of menopause. There's some people who are actually going through menopause and they cannot bring themselves to say it. So you're saying that, you know, you're hoping that it'll get to a point whereby women are, I guess, as they are anticipating or preparing to go into menopause, they should actually be excited for it because it's a
Yes,
transition, it's part of life. But for them to be able to get to that stage, two things have to happen. They have to be educated about the symptoms, and what's obviously going to happen. But they also need to realize that the symptoms doesn't have to define them. It doesn't have to disrupt their way of life. It doesn't have to make life miserable for them. If anything, if they're equipped with the knowledge of what to expect and the knowledge of how to mitigate the symptoms and deal with the symptoms and how to actually lessen the harshness of the symptoms, they can actually have an amazing life as they, progress towards their
yeah,
life. That actually
yeah.
brings, I guess,
And
my
you and I know that
yeah,
when we've met, like my clients who are going through menopause do YFIT, and we've got a menopause track going on with the Global Challenge right now. But
yes,
all of the women going through menopause, they do experience a significant reduction of the severity of symptoms.
yes, yes. I'm glad you actually
I think
mentioned
some
that
of them,
because
some of them who've gone through early menopauses have their
mhm,
periods come back.
yeah,
And some women have been struggling with fertility issues, get
yeah,
pregnant. So
mhm,
that is, your body knows how to heal itself. You just need to
yeah,
give it the right substances, and then
yeah,
it fixes itself. It's
yeah.
amazing.
Yeah, it's amazing. Actually, it's. I'm glad you sort of mentioned the globe because look, WildFit is like such a lot of people are getting to know about the program, and right now they're actually doing the track, like you said, and it's a menopause track, and I am part of the menopause track, and it's just amazing. I think the reason why I was just so intrigued about this topic that I honestly knew nothing about, but I feel like there are people who are experiencing it that we're really talking about, or at least some of my clients anyway. The reason why I'm very intrigued is because some of the people who are talking about the program, and a few of them have done the program a few times, they seem to mention how, I guess, better their quality of life has been. One, look, first of all, WellFit is not a diet. WellFit is a lifestyle program. It pretty much teaches them how to actually nourish their bodies better. So I guess that brings me to my next question. What can nutrition really help with? And why do symptoms become less bothersome in well-nourished women than those who actually are not well-nourished? What is the difference there? Like if I was to tell someone, oh, you have to take care of your health and nutrition, why is it that the ones who are well-nourished know how to take care of their body have a less bothersome symptom than the ones who probably know nothing about nutrition? Why is that?
Well, before we talk about the nutrients, we'll talk
Yeah,
about, Eric talks about your physical needs. You've got
yeah, yeah,
significant physical needs. So,
mhm,
your need for deep breathing, your need for hydration, your
yeah,
need for movement,
yeah,
your need for touch, and your need for sunlight, and then your need for nutrition. So
yeah,
your physical needs have to be met. And
yeah,
then you have your emotional needs, which are needs for being close to somebody, being valued, being considered important, making a contribution, growth. All of these are emotional needs.
yeah,
Now, in your physical needs, your nutrition, being nourished adequately, actually frees up your body to take care of every cell. It energizes the cells. It makes it easier for them to repair damage, rejuvenate, revitalize the cells for every day that you wake up. So you're sleeping on time, getting up on time, getting through the circadian rhythm. And when your body is not stressed by its environment, your cortisol levels are balanced and low.
Yeah.
When your emotional needs are being met, also your cortisol levels are balanced and low. And remember, in evolution, human beings didn't used to get stressed out over what am I going to dress for dinner, or other teenagers are going to scream, or what is my boss going to say today. The only three things that stressed you out. One was starvation. The second was being attacked by wild animals, and third was being attacked by other human beings. And that didn't happen very often. Maybe 2 or 3 times a year. So your cortisol levels were never elevated chronically. In women, the women who manage menopause best are the ones who dedicate to self-care, meeting their physical and emotional needs. They get their cortisol levels down, and in addition, by investing in oxytocin boosters. So you have a number of ways in which you can boost your oxytocin. For example, laughing, engaging with your lady friends, going and watching a movie, petting, spending time in nature, counting the stars, which means you need to be far out enough to be able to see the stars. Embroidery, being part,
dancing, singing, watching comedy.
Dancing, singing, exactly. So everything that boosts your oxytocin levels also lowers down your cortisol level.
Cortisol, yes.
Then you have more of the substrate available for estrogen and progesterone. Yes, as you age and go, they will decrease, but it won't hit you the way it does when your cortisol levels are elevated. Now, lack of adequate nutrition is a major cause of stress for the body. And you may not be getting adequate nutrition, A, because you're not eating the right stuff, or B, because the menopause state your body is in is not allowing you to absorb what you're eating. Now, for menopause, and you heard during the menopause track, he spoke a lot about protein levels, adequate protein levels, adequate good quality fats. Now, when you boost your protein intake and good quality fat intake, it allows your body to read it if you do it in time. If you do it in time. So we're talking about late 30s, early 40s. Okay. And reducing your sugar load significantly.
And we're talking about refined sugar.
Get your belly fat down. Your visceral fat needs to be down. Because the more fat you have on your belly, the more circulating problems you're going to have. The more difficulty you're going to have with managing sugar levels. Now, as you nourish every cell in your body, it will release any excess fat. And as it releases fat, you'll find that you have more resources available to balance these decreasing estrogen progesterone levels. Your mood is more balanced. All of the different end organs are better nourished, and you're better able to absorb what you're eating.
So you said increased dietary fats, increased protein levels, obviously reduced stress,
and lower carb levels,
lower carb levels, and you're saying to
the pollutants, decrease the P's, so plastics, pesticides, pollutants, personal care products, petrochemicals. So we have to focus on, which is why we talk about eating the best quality.
Best quality grass-fed, grass-fed meat, for example, or organic veggies and stuff to avoid the pesticides. So you're saying that obviously we don't have much time to talk about the menopause. You're saying that for the ones who are not yet, because people might think that, oh, I'm not in menopause, I don't need to hear this stuff. No, before you actually get there, you want to prepare your body so that it's actually able to withstand or deal with the menopause. And one of the things that you say to do is obviously start having good quality foods, reduce the 5 Ps and the pesticides. I guess refined sugar. When we talk about sugar, we're talking about refined
sugar and processed food, or processed not fruits, but even fruits. You don't want to be eating lots and lots of fruits all the time. I have patients who eat fruits every day, and that's no good.
And that's the good thing is that that's actually what
you don't want to be eating sugar every day.
Even if it is that Welsh teachers about that. Excellent. Okay. So reduce the
I think what happens, D, is that many women who've gone through menopause think they don't need to hear this because they don't know that it's any use for the life that's coming. But actually, we know that your risk for fractures increases as you get older. If you have a family history of fractures as well, your risk for Alzheimer's still goes up. You know, if you're suffering with high blood pressure or diabetes, you need to know that it's reversible.
Yeah. You know, you touched on a little bit about osteoporosis. I'm going to mention that quickly, but maybe just because part of the topic was about functional fitness. I think because you talked about brittle bones and, you know, bone density and everything sort of reduces. So how would you define functional fitness, and why do women actually need to focus on functional fitness, you know, compared to the current trends, you know, heat, muscle building, weight training? Would you be able to maybe just touch on that?
Yeah, all of those exercises are great. And this ties in with our previous point where women, as they go through menopause, they don't think they need it. Actually, what happens is that as you get older, one of the worst fears we have is of being dependent on somebody. You know, to change your toilet, you know, going to the toilet, having diapers, you know, ending up having a fall, fracturing a hip, being bedridden. These are our biggest fears. So functional fitness is something that allows you to be in charge of your body and your own well-being, to be able to look after yourself. That's what functional fitness is, which means you need to be able to get off the chair yourself. You need to be able to cook your own food. You need to be able to dry your own clothes. You need to be able to clean your own self in the toilet. You need to be safe in the bathroom so you don't fall over. You don't slip. You need to be able to be confident at night. So if you do get up to go to the bathroom, you know where the light switch is. And you can see your way all the way to the bathroom and you can get help. You need to be fit enough to be able to go and do your own shopping. So that is what functional fitness is. How do you build functional fitness? Is by doing functional things. Which is getting up and on and off the floor, you know, practicing compression and expansion exercises that vascularize your internal organs. You know, learning to mobilize your neck and your spine so you maintain spinal flexibility. So your joints remain flexible and strong. So your ankles remain flexible and strong. You don't fall over just because your foot hit a pothole. You learn how to fall so that you don't end up fracturing your wrist. You learn which parts of your body are wide and able to tolerate loads. You learn about spatial awareness, because, you know, one of the commonest reasons people fall over is because they're in a busy street and somebody just knocks them. And that's enough to push them off balance, because they don't know how to walk and regain balance. They end up falling, fracturing the wrist, fracturing the hip, or having a spinal fracture. So functional fitness is something that allows you to sit tall. It ventilates your lungs and also helps to oxygenate the organs in your tummy, organs in your chest. That's what functional fitness does. And that's what me and Rocky actually teaching in the mornings here. I undertook training to become a coach in a practice, ancient Indian martial arts training, which completely transformed my fitness practice. Because until then, I was doing what all these women are doing, going to the gym, trying to go for walks, you know, doing my yoga stretches, doing Surya Namaskars, skipping, trying to do skipping. And when I discovered my Padam and Karlakatai, both of these are very ancient, traditional Indian functional fitness, martial arts. They're preparatory exercises that the local population used to do. And what I discovered is when you incorporate functional fitness into your movements, your ability, your mental ability, your focus, your emotional well-being, your ability to deal with everyday things, you just step it up again.
Is that for every age group or just women in the menopause?
Every age group, men, women, children. Because remember, 60,000 years ago, the kings and queens, they depended on the local population to step in if they were invaded by, you know, a neighboring country or neighboring king. So the population, the local people, needed to be ready to wield weapons. Step up. You know, if you're a farmer, if you're a dancer, whatever you were, if you're a housewife, you needed to step up. So they were trained in functional fitness.
Okay, so I'll ask you a question.
Basic martial arts.
So I'll ask you a question. Look, I'm 40 years old, turning 41 in November. I don't mind saying my age nowadays. Before it was like, no, I'm not gonna say it, but now I think I'm aging gracefully, if you like. But in saying that, obviously my nutrition is great. One of my issues that I have is I guess iron, because I've been anemic for a while, and then I realized that it's because of the absorption. And I've just now found out that I have to incorporate copper and whatnot. So I'm trying to work on that. What I realized a few, I guess, weeks ago is that I'm getting, I guess, a bit of some joint pain. So would you say, I guess, someone my age, especially, because I'm very keen in aging gracefully and getting to 78 years old, and I'm still sort of like doing functional things myself. Would you say that the functional fitness would actually be beneficial for me as I incorporate it with my nutrition? Or because I just feel like, okay, I'm starting to dance every morning as well, but I realize that sometimes when I'm trying to meditate and I have my legs crossed, there's a few months ago I was able to cross it, but now it's like when I stand up, I'm like, okay, my bones feel like they're. So I'm obviously becoming more aware about this. Do you think functional fitness would be able to help me out with that?
Functional fitness, and also monitor your symptoms. Nowadays you have a lot of these menopause symptom trackers. You can download them app, or if you have my book, then you can download a symptom tracker as well, and
Yeah.
you can just monitor your symptoms each month, or once in 6 months, or once in 3 months. A lot of joint stiffness does start to happen in your 40s because of decreasing estrogen levels. For
Okay.
you, if you find you're going dancing, you'll find you become more flexible.
Yeah, I'm starting to dance.
The longer you experience spring in wildfit, the more flexible you become.
Yeah,
So
yeah.
that is definitely something. And functional fitness, definitely, it strengthens your ligaments. The ligaments that support your bones. It strengthens that, so that your ability to move becomes easier. Balance improves, the coordination improves, your spatial awareness improves. So
Yeah. So for the people who are watching right now, Dr. Nilima talks about spring. Now, spring is just part of the season that WildFit teaches you. So if you do end up joining WildFit teaches you how to actually eat in different seasons. So like I mentioned, with my joints and everything, I'm going to go into this season whereby it's a season of healing, and it's the best season to be in. So really, that's just one of the indications that you actually get to get there. Now, I guess before I go to my next second last question, with the functional fitness, if anyone was to sort of like have an idea or maybe get some information, do you have it on your website or is it on your Facebook page? Because I know on your Facebook page there's Dr. Nilima Deshpande. There's a lot of videos there. Do you have the functional videos there as well?
I'll put it there. I've done a YouTube video on functional fitness on my Padamentalakate. It's an information video. I'll put it there.
Okay, that's cool, because I'll be happy to sort of like get the link, and then I'll post it on my page, or anyone who's really interested in. So anyway, for those who are watching the recording, you can always go to Dr. Nilima Deshpande's Facebook page. There's quite a few information there on everything that we talked about today, so that would be good for you. Now, you talked about
I also wrote a book, so
I wrote a book as well. Yeah, where can they get that?
Unlimited, you can have it for free. And then it's available worldwide now. So it's on Amazon. It's called Menopause Made Easy. It's 121 tips to guide and inspire. Menopause Made Easy, 121 tips to guide and inspire.
Okay, excellent. So Menopause Made Easy, 121 tips to
guide and inspire.
Excellent. Guide and inspire. So for those who listen to that, they go to Amazon, they'll be able to get that. And also, like I said, on your website, they'll be able to get more information. And I'll also post the functional fitness link for them to obviously have a look at, because I know I definitely need to have a look at that as well, as I'm trying to get more flexible. So you talked about osteoporosis and you called it a silent epidemic. What do you mean by that?
The reason I call it the silent epidemic is because most women don't consider osteoporosis a problem until they get a fracture. So, this typical little old ladies we call them little old ladies, not because they were little before, it's because they've shrunk.
Yeah, what's up with
that?
They
kind of lose height, they get that hump in the back, they're not able to stand straight against the wall. And what typically happens is that their spine starts to collapse. And as the vertebrae collapse, it can cause an incredible amount of pain and discomfort. It also scrunches your tummy up because the gap, the space for your internal organs decreases. You're at much higher risk of getting fractures in the spine as well as the hip. And one of the problems we know is that after the age of 75, if you end up with a hip fracture, over 60% of women are dead within a year.
Oh, wow.
And you end up being bedridden. So it's a very, very significant problem that causes a lot of problems with quality of life, especially end of life. It's very painful and uncomfortable, and it takes away your independence.
Yeah, yeah.
And because of the rate at which the number of women aging is increasing, we're going to see epidemic proportions of osteoporosis in the next 5 to 10 years. And the problem with osteoporosis is that it's preventable.
Yeah.
And your preventive action can start well into your 20s and 30s. I think as a WildFit coach, you and I both know that we've suffered the consequences of being told to drink milk.
Yes, that yeah.
And coffee and tea,
Yeah.
and all of the stuff that robs our bones of healthy calcium.
That was a shock to my system.
Not having enough protein in our diet if you're vegetarian, not having good quality calcium, not having adequate exposure to sunlight to get the vitamin D we need. We're all chronically deficient in vitamin D. So all of these factors are contributing to a population that's going to be suffering lots of falls and fractures. And the steps are not in place to help women prevent it. Now, there will be a significant number of women who go through something called premature menopause. They go through menopause before the age of 40. Those women are at increased risk of not just osteoporosis, but also heart disease and dementia. If you consider that the risk for dementia goes alongside the risk for osteoporosis, people with dementia are more likely to have falls and fractures. Now, for many people, they, when I get old, I'm just going to die, I'm going to leave. The problem is if you don't die, whether of heart disease or dementia or osteoporosis, if you don't die, you're going to be stuck in an old people's home or a bed, really, really suffering the last few years of your life. So osteoporosis can be prevented well in advance with good sunlight exposure, adequate physical activity, functional fitness, prevention of falls, fixing your nutrition so that you're not dependent on dairy. Dairy doesn't give you calcium, nor does it make your bones healthy. And the quicker we get out of the trap of the advertising companies about dairy, the less we're likely to encounter these problems as we get older. So when your joints hurt, it's not your bones. Your joints hurt because there's less fluid in your joints. When your bones fracture is when you understand that you've got a risk for osteoporosis. So there are a number of people who are at high increased risk. People who are smokers or drink a lot of alcohol, have been drinking a lot of coffee. They've been on steroids for bronchial asthma or other autoimmune diseases like rheumatoid arthritis or lupus. So they're on long-term steroids. Women whose mothers, or women who've gone through early menopause, or women whose mothers have had very poor bone health through their pregnancies, or early menopause, you have an increased risk of having fractures of osteoporosis. And if you come into that category, or if you have thyroid dysfunction as well, thyroid dysfunction, parathyroid dysfunction, if you had surgery for a hyperactive thyroid, also you're at increased risk of bone disease, osteoporosis, and fractures. So these women do need screening. If they're screened, they can be treated correctly. So that they don't suffer fractures. And they can put into place, I know women who've been diagnosed as early stage osteopenia. So, you have osteopenia and then you have osteoporosis. Now, osteopenia is the reversible part of osteoporosis when you first start to get bone deficient. Women who institute changes like WildFit, functional fitness, movement, and the osteopenia stage have reversed that problem.
Wow.
So your bone is a dynamic living structure. In India, at least, there's doctors who carry on prescribing vitamin D and calcium, vitamin D and calcium. Vitamin D and calcium don't do anything for your bones unless you're willing to do weight-bearing exercise. Because your bone is a living structure. It responds to stresses and strains, which is where functional fitness also comes in. Stresses of strains of actually getting up off the floor, getting up off the chair, lifting things from one place to the other, involving twisting movement. Your bone doesn't know how to respond unless it is stressed. your body will extract the calcium from the stuff you eat based on the needs of your skeleton. So it's really important to move your body, which is why movement is part of your 8 physical needs.
Yeah. So you're saying that obviously you could be taking all these supplements, but if you're not exercising your body, it's like you're trying to, it's not going to work out. Wow. Okay.
And remember, it's about body weight exercises. So you can't be sitting on a bench and doing presses and expect your body to extract calcium. It won't do that. Your skeleton needs to be under stress and strain.
Okay. And I mean, when you say, because you said before about spring, because spring is all where we sort of like, give the body a break from, sugar and everything, which means the pancreas gets a break. So that is the best time to also sort of like do the movement as well, because there's calcium being restored, the calcium that may have been used before.
Yes.
And so spring would be a good season to obviously, try and replenish some of the calcium loss.
Yes. Yes.
Okay, so that would so if you were to do spring plus the supplements and then plus the exercise, that would probably help you get there better, but not just taking the tablets. Okay, that's important information.
And did you know, Dee, women who have great bone health and they have a good calcium and vitamin D metabolism also suffer fewer menopausal symptoms.
Oh wow. Okay, so it is possible to suffer, like to deal with fewer menopause. I don't think a lot of women know that, to be quite honest with you, because I feel like at least the ones I've spoken to so far, or at least the ones who reached out, it's almost like they're just resigned to the fact that it's part of aging. This is what I need to deal with. So I think a lot of women will be very happy to just hear that, yes, I'm going to go through menopause, but it doesn't have to be a bad thing. I might not even need to experience any of the symptoms if I know how to take care of myself prior and during the process of going through menopause. So I guess, to be honest with you, I feel very confident going into that, because like I said, a lot of people are scared about the whole topic in general. But for me, it's important to be able to know this. And even when I'm dealing with my clients, it's going to be very important.
The fitter you are, the more mobile you are, the more functionally fit you are, the less you also have problems. The genital problems also decrease.
Yeah.
The more, if you don't use it, you do lose it.
Yeah.
So same thing. When I talk to couples where the woman is going through menopause, I say having sex is not just the need of your partner; it's your need as well.
Yeah.
If you have a partner and you're sexually active, your vaginal lubrication, stretching, etc., will maintain itself.
Okay, so you're saying that even though they're going through menopause, it's still okay for them to have sex.
Yes.
It's not like they have to stop because they're going through. So it helps, I guess, to mitigate the whole dryness that
Yes.
women are.
It does.
Okay.
They can they can take the help of lubricants, they can take the help of some vaginal estrogen if they need it, but they're going to have a much better quality of genital health than somebody who's not sexually active.
Okay, that's great. Well, look, to be honest with you, we've gone through pretty much most of the questions. You've answered most of the questions that I had. One question that I did have from I think one of the viewers or someone who wanted a recording is, I think you may have touched on, but maybe just briefly, just so at least she feels like it's been answered. One of her questions was that, is it possible to have fibroids reduced or shrunk without surgery? I think that would go, and correct me if I'm wrong, would that?
There's a number of medical interventions and radiological interventions that can be done for huge fibroids. That's probably beyond the scope of our discussion. Yeah. But one thing that's reassuring is that a lot of fibroids do shrink after menopause. Now, which fibroids need treatment? Well, if your fibroids are causing a lot of heavy bleeding, if your fibroids are causing pressure symptoms, if your fibroids are the cause of your infertility, if your fibroids are causing a lot of pain, or there's a suspicion, or less than 1% of fibroids ever become malignant, but if there's a suspicion that that fibroid might be changing, then those are the fibroids you want to get treated. Yeah. Now, there's a hierarchy through which most physicians will talk you through a management of fibroids. So they'll first talk about conservative ways to treat fibroids, medical ways. So there's some medicines and treatment. A lot of medicines will often put you into a menopause kind of state. A menopause state is where the hormones that make fibroids grow are cut out. So a lot of that's what medicines will do. Or there's radiological interventions where if there's a major blood vessel that's supplying a fibroid, you can have those blood vessels embolize so that the fibroid shrinks and dies off.
Okay. Well, that's great. I mean, look, to be honest with you, there's been so much. I think we've actually, we're sort of at time right now. We've done really well with the questions and answers. Look, I'm going to be honest with you. I mean, for someone who's trying to learn more about different kinds of elements for women, both women and men, because I obviously deal with both of them, it sort of is very, I guess, reassuring when you are, when you have an expert like you say things like it's possible to deal with these symptoms or ailments just by changing a few things. Because for someone like me, I like to know that I have control over something. Because if I don't have control over something, then I don't sort of focus on it. I try to focus on what I have control over. And for you to say that there is control over your symptoms of menopause or how your quality of life is during menopause, I think it's a very reassuring message to a lot of people, which, I mean, I think moving forward with my classes, I'll be able to at least convey that message. So maybe just as a last thing, if you don't mind, if you were to maybe leave a parting message, for anyone who's watching the recording right now, as an expert in women's health, what's the last thing you could say? I mean, I guess to anyone watching this, who's sitting there, either they've been reassured by what you've said or they feel more hopeful. What is the one message you tell someone who's either going through this, doesn't maybe until now didn't know how to have any answers as to how to deal with it? What would you tell them? What would you be your message to them?
My first message would be to relax, because it's not the demon that everyone thinks and talks it is. It's just a life transition. It's completely physiological. It isn't something you can prevent, unless you're planning on not being around after 50. The fact that you can celebrate menopause is a huge gift, because it means you're living longer than most women on the planet would live.
Wow, I like that. I mean, I'm just going to reiterate that for the people out there. Going through menopause doesn't have to be a death sentence. If anything, it's the opposite of that. It means that you're living longer than, I guess, what most women lived in the past. And it's like a new chapter.
Yes.
Life.
And your biggest gift to yourself will be to educate yourself and all the women you come in contact with. Because remember, prevention of a lot of the health issues that happen as we age begins 20 or 30 years before they actually happen.
Wow.
So if you want to prevent, if you don't want to just be a statistic and die of heart disease or hypertension or diabetes, then put the effort into preventing it 20, 30 years before. If you don't have 20, 30 years, then start now. And it's going to pay dividends. Alzheimer's, dementia, osteoporosis, you don't have to go through that. If you have a mother-in-law, sister-in-law, somebody who's not willing to learn about menopause, they will still be interested in preventing Alzheimer's disease and osteoporosis. So it's still worth educating them, communicating with them, and helping them to understand that they have power in their hands. There's never going to be enough menopause physicians in the world. We need more women to empower themselves, to learn how to look after themselves, to prevent falls, to improve their functional fitness, so that they don't have to deal with those kind of problems.
Excellent. Thank you so much. I mean, you have no idea what this means to me. I mean, like I said, I'm always grateful to have you, as an expert, in women's health. You have so much knowledge in you. I mean, to be honest with you, I could go on and on with you for I would need at least 3 hours to be able to get all the information that you have on women, because there is so much, there's so much that women go through. There's so much information that needs to be put out there. And look, having your time for you to set aside, Saturday is actually I'm very grateful for that. And I'm sure everyone who's going to be watching this, recording will be grateful for it, because we've been able to at least touch on some very important topics that I believe a lot of people will be able to either, learn from it, or at least teach the people who obviously loved. Now, as a Wild Fit coach, I feel empowered, to be honest with you, dealing with women as I go through, Wild Fit, or just learning everything that women require to, I guess, take care of themselves. And I am very grateful for you. I'm obviously very privileged to know you as a Wild Fit coach. We both know what Wild Fit is doing for people out there. And I guess your time and motivation and your I guess your excitement really in dealing with a lot of people is very encouraging and inspiring to me. So thank you so
Thank you.
much for your time.
Thank you.
For everyone who joined us, look, thank you
Thank
so
you
much
for
for
inviting me.
recording.
Thank you for inviting me. Thank you.
Very, very welcome. To be honest with you, if I would have 2 or 3 hours with you, I'd be very, very happy. But look, I know you have your clients to always deal with. So for the guys who are watching this, like I said, you can go to Facebook, Dr. Nilima Deshpande. There's a few videos there which are actually there, very, very educative. I will post a link on the about the book. I think the name of the book and the link for the functional fitness, so that at least you're able to obviously have a look at that. So for anyone who has any question, please send me a message, an email, or post on the Facebook page. Otherwise, thank you for joining us. Thank you again, Dr. Nilima. I really appreciate your time. And
Thank you.
yeah, for everyone else, thank you so much. I'll just stop the